Welcome everyone to the webinar that is organized by the Cost Action Net for Age Friendly, the international and interdisciplinary network on smart, healthy, age-friendly environments. Very welcome all participants, and a special welcome to Mireia Ferri, who was really at the base of this development of the impact tool on development of how can you define the impacts of smart, healthy, age-friendly environments. I will come back to that later, but thank you very much that you are here. We will have the order of the program is that we will have that I will tell shortly about the background of the impact tool, the considerations, the cycle, and the possible impacts that we can define, and how you can make an analysis and monetization and quantification of the impacts. And then we perform a joint exercise in breakout rooms. And the breakout rooms are shared by Luisa and Luisa Spiru from Romania, and by Javier Ganzarain and Lucia Tielman from my colleagues. If more people enter the room, if more people enter, then we will create another breakout room as well. But that is for now. As we know, the main aim of the smart, healthy, age-friendly environments, networks and cost action is that we would like to improve the well-being and health of citizens by implementing the combination of user-centered, digital, physical and social solutions for inclusive environments. We consider the health and well-being of citizens of all ages, so that we have the lifelong approach. But while doing so, how can we define the impact of SHAFE? And exactly what are the impacts of SHAFE if you look at this from the social, economic, or environmental perspective? To define that, I was really considering what we developed in the past, and also made a short literature search. And then I found that the most impact tools that are existing are very, more focusing either on social or either on economic, and not much of the combinations. But in the past, we developed, together with Mireia Ferri and Rod Bond from Ireland, we developed the so-called SEE-IT tool that was to enable local authorities, local and regional authorities, to perform an ex-ante or ex-post evaluation of impacts, and then especially impacts of the age-friendly environments. As we are talking here in the cost action for smart, healthy, age-friendly environments, I was thinking, why don't you use this holistic approach of an impact tool and rename it to SHAFE SEE-IT, because we also use the past from it as as the tool was developed then. And if we look at the SHAFE SEE-IT approach, then what we first should consider what should be considered. Especially now we are looking at the smart, inclusive, healthy environments, and we consider the SHAFE initiatives, practices, and policies. Who do we consider? That is the citizens of all ages in a society for all. And we also look at different geographical levels that can be on a neighborhood level or a local level, regional or national level. This is all depending on also on the volume of the measurements that we will take. And also, when do we consider? That is when at the start of an initiative, the program, policies or project, we can perform the impact analysis before the start of something, or after, midway of course, but also after. So if you ex ante and ex post evaluations. The SHAFE SEE-IT cycle is following the following course, is that we at first we define the aim, then the scope, assessment, we make an analysis, and then define the results or present the results. To be more concrete, for the aim, you define the core problem. For instance, you can think of the example that people are having too much overweight nowadays. So that is the core problem. That is the people are too unhealthy because they have too much weight. And then the aim is to define how to reduce the weight of people that are there. And then you can have specific objectives that you can define. The scope is defined that you say, for instance, that the scope is that you define, oh, we're talking about the population of Europe, or we'll talk of the population of Poland or the Netherlands or Belgium. That is the scope that you define, or at local level or smaller level, than that is the scope of it defined. Also, the scope is the timing that you include. For instance, we want to have the scope for 5 years or 1 year. Then also included in the scope is to make a baseline zero assessment. What is the current situation at this moment and where it's going to be? And in the scope also you include possible solutions that you can apply. And then you make the assessments, and that is based on the impacts that you define. If you think of, in the example of too many people have overweight, then you can think, okay, what is the impacts that we should imply in one of the solutions that we will find? You can think of the social impacts, and then you have the health and longevity, the safety, meaningful and inclusive, that the impacts can be that the education and lifelong learning is improved, or the literacy levels are improved. The quality of social interaction can be considered private and family life, personal data, and basic rights and responsibilities. I shared these impacts also for the following page. I shared this impact last week in a document in an email that I sent to everyone. And during the breakout sessions, you will find also these impacts again presented by the moderators. We also can consider the economic impacts for instance, that the impacts of standard of living is relevant to be included in the analysis. Economic prosperity, public budgets, market mechanisms, innovation, R&D, consequences of the impact, sustainable consumption and production, and the property rights. And then we also consider the environmental impacts, and that you look at the natural environments, but also to the land use, the settlement, the housing impact, what it has on housing and transport and mobility. These are just the overviews of the impacts that you can think of. So that this can be taken into account, and it's very wise to perform this exercise to consider which impacts are relevant and which are not. And if you go to the analysis process, I think it's very important that if you, for instance, perform an ex-ante evaluation, that you create an assessment team. And the team should be diverse in different disciplines. It should be gender balanced, and also taking into account all the multiple stakeholders that are relevant for the assessment. Then you identify the key relevant impact domains that you choose from the lists that I just presented, from the social, economic, and environmental impacts. And then you perform the assessment together in the group. And you define per impact, is the direction negative, neutral, or positive? For instance, if you look at the longevity, is the proposed solution, does it have a positive impact on the longevity, or is it just neutral? That can also be, or negative even. Then you define what the direction, is it the intensity? Is it neutral, strong, or very strong? the impact very intense or not? Then you define who or what is impacted, and then you also define, is it directly or indirectly impacted? For example, with the overweight, if you if you have a measurement that directly impacts the people that have overweight, or is it just indirectly, for instance, that the shop owners have less income because people don't buy any more sweets or something like that? Then you also look at the monetization and quantification of the impacts, and that I'll come back later. And then to finalize the process is that you make an analysis of all the findings that you have, and that is also that you perform in the group. And then you define the results. What do we think of this solution or solutions that we take into account? Do we go in this way, or shall we replace it by another solution? Now I come to the monetization of the possible impacts. And as you may know, in many Horizon projects, also the impacts you must define beforehand. And then there is one of the asked questions of the European Commission is about the scale and the significance. And that is quite a difficult, how do you define scale and significance? And in the European Commission provides the answer, that is how widespread the outcomes and impacts are likely to be. And the significance is the importance or value of those benefits. In the literature, I found a nice example, and that is to recognize the differences between scale and significance. And that is, for instance, scale is that you have a law that has a positive impact on the health and well-being of workers. But the significance is defined by the question if our people are how do the workers value their own health, or what are the other depending factors that they want to have. So that is the difference between scale and significance, but it's quite fluent, I still think, while working with it. You can also think of defining the impacts in a kind of a monetization of non-market impacts, and that is that you link them to market prices. For instance, that you define it in the number of decrease in the number of euros that has the effect of the decrease of hospital admissions or less medicine intake. You can also consider the timing and sensitivity and incremental considerations, and that is the impact on the short term, or is it on the longer term and the midterm? How should it be? And also you can consider, is it not every measure that we take in the field of smart, healthy, age-friendly environments can be fully accountable for for instance, the positive for an improvement. So you can also consider what is the incremental improvement of the SHAFE strategy. So because also other influences should be taken into account. Another monetization of the impact is that you look at the costs. That is, for instance, the setup, the maintenance, operational costs, but also consider the administrative burden of a measure that you would take, and the gains and losses. That is the direct and indirect market gains and losses. You just define how many you would lose or gain. You can also make quantitative analysis, and that is, for instance, the definition in the non-monetary approaches, in the quality adjusted life years, and that is that your measure leads to the improvement of a year of life in perfect health, and then you can count every year as one. Or you have the contrast is the disability adjusted life years. That is that if you don't take a measure, that it would count as years lost or something like that. You can also define it in the healthy life years, and that is the measure of number of quality adjusted remaining life years per person. And we as many of us came from the European Innovation Partnership of Active and Healthy Aging, that +2 healthy life years was the aim of the European Commission at that time. You can also think of the monetary approaches. That is, for instance, that you reduce the cost of illness, or that you also calculate the human capital. For instance, if someone gets an accident when he's 20, and then you can say that he probably would live for 60 years, so that you can see and would have earned such amount of money, and that is the loss of human capital. You can also think of the preference-based approaches, the value of statistical life, the value and willingness to accept higher or lower levels of risk, or the value of statistical life year, the increase of one additional year of life expectancy. Please note that these preference-based approaches do not say anything about the quality of life. So that is, it's only 1 extra year, but it doesn't mention if it's a good year or not. And then the last monetization aspect of impact is that you can look at the life cycle assessment approach. And that is what one measure does from the start till the end, so that you consider all the impacts from during the life course of one measure. And this is the so-called cradle to grave approach. Are there any questions, maybe? Because now we're going to step to the exercise. And you can also ask your questions or discuss your questions during the breakout session, so that Senior, yes, please.
Yes, thank you for introduction to this assessment approach, but it seems very, very comprehensive, and I wonder about the information source, where, let's say, to how or in what way to collect the information necessary for assessment. Because it sounds very general, yeah, and is it like the already existing, or is it includes and specific methods for data collection in order to get or to provide assessment?
You can the assessment tool, the SEE-IT, comes from the AFE-INNOVNET project. But you can use different multiple sources. For instance, the Eurostat data, and this is the methodology to define the impact. So it's where you get your data, and also if you have at local level, many municipalities have a statistical department that you can also provide many details or data on the for instance on the population or you have health data from people, so that you can define it from different angles. That is, so I'm not. I think where you choose your data is one of the important things that you as the researcher should offer, or the consultant should offer. But also one of the main important things is that you consider what is the impact of a measure, and by involving many stakeholders, that is also that you have a raising awareness, but also support for what you are doing. I think perhaps now I'm already graving my own grave, but it's not especially about how good your impact is as such, but also the raising awareness and the support of all the group is very important. Is this the direction that we want to go? And that is the most important. And of course you can quantify as much, but you cannot quantify and especially not predict everything, because sometimes things suddenly go differently. But thank you for asking that. Very
thank you.
Yeah. Shall we go to the exercise? Then I will explain a little bit the background. We will go through the same circle of the aim, scope, assessment, analysis, and results. And to save some time, I already defined the aim. As you know, that SHAFE aims to improve the health and well-being of citizens. And the objectives are that we achieve person-centered solutions by focusing on user-centered design. We will have measures that to implement the combinations of digital, physical, social, and inclusive solutions and environments, and to capacity build and empower citizens. These are the objectives that we will take into consider just around. The scope of the assessment is that it's in an impact of the neighborhood in Europe. You can define it everywhere. And the baseline scenario is that the houses are not designed and equipped for an aging population in that neighborhood. The number of people with overweight grows from 10 to 30% within 1 year, and the loneliness among the loneliness figures are that 30% of the population feels extremely lonely. To solve these issues, we have found some solutions, and these are just these are for the solutions. This is just for the sake of the impact assessment. So please consider this. It's not about the solution as such, but it goes for the impact assessment. So we have 6 solutions, and we will have 3 breakout rooms, I think. And isn't it, Lucia? I think, yes. We will have 3 breakout rooms, and you will be manually dedicated to one of the breakout rooms. The solutions can be a smartphone app on smartphone for connectedness, neighborhood coaches, home adaptation funds or loans, financial bonus for healthy lifestyles, walkability of the neighborhood improvement, and the education of the population. During the assessment, but the moderators will guide you through, is that at first you will define which are the possible impacts of the social, economic, environmental domains that you think are relevant, so that you will discuss this in your breakout room. You will choose 3 possible impacts, and then to discuss in this exercise, and then you define, is the possible impact has negative, neutral, or positive? What is the intensity of these impacts that you have chosen? And how would you define the scale and significance of these impacts? And can you further monetize or quantify the domain? You will have a breakout session of 30 minutes. And after that, the moderators will report on what you have discussed and what you found. And then we will have a plenary session that we will conclude and discuss further how it was and what you like. Okay, I give now the floor to my colleague moderators, Lucia, and Javier. Yeah. And also to devote everyone to the breakout sessions.
Yes. Much, Willeke. A short question, because before selecting the possible impacts per solution, do we select already which groups will be dedicated to which possible solution before we go into the breakout room, or we do that within, just to avoid that we select similar solutions in different groups?
I have assigned every group a solution already.
So everyone goes now.
Very good, thank you.
Okay.
As I said yesterday, I'm assigning health and longevity because this is our specialization. But meanwhile, I'm the working group for European coordinator for SHAFE in Net for Age Friendly. But meanwhile, I would also like to discuss about education, long life learning, and because this is, I have with me Cosmina Paul, who's my company and my partner. Cosmina, are you there? Isn't it?
Yeah, I need to.
Okay. So,
but are the breakout rooms ready now?
I mean, they are ready. And Luisa, I gave you education as we discussed yesterday.
Yes, education, longevity, and health solutions. Okay.
Yeah.
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 Okay.
All
And
right.
policies as
Can
well.
you launch the breakout rooms?
Yes, I will. 1 second,
Um,
because some people. Yes, I will open them now. See
Okay.
you later.
See you later after 30 minutes. Hello, back again. I
Hello.
think everyone's returning now.
Yes, Willeke, it was a very good meeting. Okay, we are in time, isn't it?
Yes, we are certainly in time, and I'm just waiting for everyone to return.
Okay, thank you so much. I'll come
They
soon.
have 60 seconds, so.
Well, thank you so much, Willeke. I'll come back very soon. Thank you.
Nice everyone to see the return. Is everyone back now? Yep. I think so. Who can I ask to report first? Louisa, can you already report what was the discussion in your...
I didn't finish, but I will share with you because it's I wanted to take a little bit time, but
Okay.
there's no problem. First of all, it was a very interesting meeting, and I'm grateful for the participants. And if I was asking them the permission to allow me to use their names for their proposal, and I think this is. And when I will make the report, I'll make just a general statement of this related to this meeting. So first of all, Larissa from Ukraine, who's an expert in ontologies, mentioned the need of what an expert in ontology needs from the medical teams, as information related to the risk factors and the population group, the interest population group in SHAFE, that is the older adults mainly, and that is a very important point for prevention, predicting, and personalized information relating to ontologies, and of course in longevity medicine. Because as we were speaking today, longevity means not living longer, but means living independent, and if possible, living in this SHAFE concept, living at home or in an intelligent environment, and very well protected and digitalized environment, but also well known and very well instrumented by the end users, by the user. So this is very important, and Larissa was very good with this. Then it is Mohammed, it's our colleague from France, who's an oncologist, and he mentioned that he doesn't. A few of the participants, they don't have actually a solution, but they have worries. And they have worries, and they have their observations according to their experience in their field of activity. And he mentioned that the microenvironments are very much different considering the country, even if we speak about Europe, about the European countries, about the the ethnicity, okay, tradition. And this is, of course, very important, and we have to adapt political strategies to each of the microenvironment in order to develop larger environments dedicated to the same population. And also Mohammed mentioned that it's very important to create questionnaires for patients in order to identify the risk factors. And this is what we call the pre-screening tools for population at risk. And when we speak about general older adults, we speak about risk of chronic diseases, about the risk of nutrition, of not good nutritional habits, about smoke, about falls, about isolation, ageism as we call it, okay, social isolation as we call in SHAFE. about mobility. Okay. Excuse me. Okay.
Oh, someone is having
okay.
microphone on, I think.
So very good point. Very good points from Mohammed.
And which impacts did you discuss or choose?
They have that. They do not have. I mean, we didn't. The impact. The impact is about creating, first of all, solutions in order to appreciate the impact.
Mm-hmm.
Because we don't have general solutions. Okay.
Mm-hmm.
So each of the specialists who came today in this meeting, they come with their experience and expertise.
Mm-hmm.
Then Monica discussed about the region differentiation. She doesn't have answers, but she proposed to co-create, to develop the co-creation with the stakeholders in order to develop this ecosystem, these SHAFE type ecosystems. And practically, this is very different. This is very different according to the stakeholders. It's a great desire to keep the older adults, especially in Portugal, because she comes from Portugal, at home and not in nursing home. So this is something that it's a very important point to develop and to create an ecosystem, a political ecosystem with stakeholders in order to keep the older adults at home. As you know, Willeke, we call this the hospital at home, okay? Or aging in place as a concept. Then from Turkey, from an expert in artificial intelligence, which is something that I love very much. Of course, we agree about the important role of artificial intelligence and the data collection and deep learning to have real-time interventions. But as we discuss here, the real-time interventions are very much depending on respecting the ethical issues related to digitalization at home and to accept to use apps at home. And to be honest, not every European countries has the same. We have the same laws, but we don't have the same national rules. And then Sandra from Italy, who's a statistician, proposed us to
from Portugal.
To write at least a paper or two papers, but in order to take care about the big data that we can offer, and which can be very prolific with one or two articles related to these SHAFE ecosystems and experience that we gained until now. And the last one is Juste. She came with she was one of the our schoolmates in the summer school in Macedonia. Mm-hmm. It's about the need of teaching the volunteers, the end users. That means lifelong learning, and this is essential to have trained end users in these ecosystems based on intelligent and digitalized ecosystem, beginning with their own homes. And I think education is very, very important, and I will try to underline to stress this very much in this at the end of this discussion, and I will underline it also in the short report that I will send to you. Okay.
Thank you. Thank you very much.
Thank you very much, all of you.
Yeah, thank you. Yeah. Lucia?
So yeah, we discussed a possible app to increase connectedness in the neighborhood. There was some discussion on how such an app would look like, because there are a lot of examples of different kinds of apps that do different kinds of things in the neighborhood, such as an app that you can use to report to your local municipality when the street is not clean or people are leaving stuff in the streets, for example, but also apps where you can see what kind of activities there are in the neighborhood. But we try to keep it a little bit general, and we didn't manage to go through all the questions, mm-hmm. but we did select 3 impacts that we took a bit of a closer look at. So we thought that an app could prevent loneliness or isolation, but that an app could have also positive or a negative impact on this. In a sense that an app could have a positive impact because it has the opportunity to increase contact in a neighborhood. People can see which activities that are there and be able to find new people in the neighborhood. But on the other hand, it could also be negative because people are using an online tool and are not having real life interactions, which could also increase feelings of loneliness instead of preventing loneliness.
Mm-hmm.
We also said that apps that promote connections in a neighborhood could have a positive effect on health and social care and on public services, because we see that the population is aging and that it can increase a lot of costs in terms of healthcare. And using an app to support people can be kind of a cheap solution. And lastly, we also discussed that apps could have a positive or a negative impact on citizen engagement, for example, because people can use an app to make reports or give feedback to their local municipalities in terms of what they think of the community. But it could also have a negative impact, and it can lead to people feeling annoyed because if the local municipality doesn't do anything with the reports that are there, and they don't, for example, have the capacity to do something with the reports of citizens, then it can lead only to more frustration, which would obviously be a negative impact.
Mm-hmm.
We also looked a little bit at what kind of intensities that we could define, and sometimes we did find it difficult to define an intensity for the selected impact, because using an app and what kind of intensity the impact would have is very dependent on the different users or how people are using it. So we weren't able to say for every impact this has a strong potential or not. So I think this is how far we came in the breakout room.
So goes quite well advanced. Thank you. And Javier, your report? We don't hear you. Javier? Let me check where we see. We cannot hear you, Javier.
I think he's having issues with his sound.
Yes, I think so. But he hadn't before, so. Okay, now that's in the meantime, when Javier finds back his voice, is there anyone who wants to discuss or have questions or whatever?
Willeke, may I ask you please something to have the assessment and analysis exercise feedback also as a working sheet?
Yes, please.
Thank you so much. Thank you.
Yeah, I will. Javier sent it yesterday to you, so.
Yesterday finished very, very late. Sorry for that. And
no problem.
Okay,
busy lives.
Yes, thank you. Thank you very much.
You're welcome. What do you think of this SHAFE SEE-IT tool? Is it something that you can use in your daily practice? You go through in the process of evaluation like this to define and think of the impacts? Don't know what's happening with Javier because he was talking in the breakout room, so then it worked. Is that maybe someone else from the people from the breakout room? On the neighborhood coaches, who was there?
Willeke, if you bring back the slides, I can help you a bit.
Okay,
Until
but he knows
Javier will find the solution.
Okay, Javier, can you present what you had so that Hetwa will report then? No, sorry. But if you can present what you your notes.
Yes.
Oh yes, please, Hetwa, go ahead.
Yes, so we choose 3 aspects. One of them is the social quality. No, it's the quality of social interaction. The second one is the safety, and the third one is the public budget. There is another people in our group, so help me if I forgot something, please. I will not mention something. The first aspect, we think that the quality of social interaction is very important, and neighborhood coaches can change or can impact positively the quality of social interaction. We see all the 3 aspects as you see as positive, which our ex-ante or our assumption, basic assumption is positive as a impact or influence. So the first aspect, quality of social interaction, we think that there is a very strong impact, but it depends on the profile of the coach itself, because not all the people have the same profile of coaches. And this leads us to, I'm going to the social awareness. This is something that we are talking or discussing in our break room, that this in the neighborhood coaches discussion, we need to develop the social awareness of the citizen, but it not come also, it's not nurtured or born also from origin from the citizen themselves. It's also come from the municipality budget. So now I'm talking across the table on the interaction between 2 aspects. So the social awareness is key objective to create this or to nurture or cultivate these neighborhood coaches. Another issue that we mentioned here is the intergenerational relationship, and we need here the behavioral changes, because we can declare that we have a neighborhood coaches, but we need actually to create some intergenerational relationship. Also, in this case, through the cultivation or the help or assistance of the public budget. I mentioned some examples that we have in the community. Kids from school, teenagers that have projects from schools or after school activities. And another aspect here is that neighborhood coaches can help or extend the involvement of other adults in the community, but not a sporadic involvement, a very organized and well-established involvement, voluntarily, actually. That's clear, meantime?
Yes.
Javier, you can write some, that's okay. Okay, in the second aspect, we talk about the safety. And here we also have a positive impact of the neighborhood coaches. And I'm trying to arm you with our arm. I mentioned that we need the individuals to be aware to other people in the community to keep or help with their safety. And we also mentioned some loneliness aspect. But this is dependent on the size of the community, technical infrastructures and resources, that funded or provided by the public budget. We don't have enough time to discuss the way we do that and how we monetize it. So I'm jumping to the third aspect. We think that the public budget have a positive influence, and the intensity of the impact we choose is natural here. But here we put our stress, so we emphasize the connection that the municipalities build between the citizen, the all citizen, the citizen in the community, and the public administration. The infrastructure for all these projects also need to be funded, organized, or I don't know if it's legalized, because in every nation or every country it's a different budget system, but it needs to be the source need to be in the municipal budget, if I try to put it simply. One of the main issues that we mention here is to educate the citizens. We find it also in the table, that the organized table that you mentioned, Willeke mentioned before. Education the citizen to be involved for the intergenerational relationship and to the social awareness in the community.
Yeah.
So if we have a pyramid, I think that the public budget will be the infrastructure to motivate this or derive these neighborhood coaches.
Yes. Thank
That's
you.
okay, Javier?
Let's see the chat.
Thank you.
Thank you, Hetva, for stepping in. Yeah, indeed. But sometimes this happens with technology also. Javier, you can stop. Stop sharing. Yes, thank you very much. We have come to the end of this webinar, workshop, whatever. Are there any questions or remarks remaining that you would like to share? Okay, no one does. So then thank you very much for your presence. Yeah, Larissa, go.
One
Please
short
go.
question. I
Yes.
would like to ask, with whom is possible to contact to realize some experiment, for example, for finding the information for development ontology and some example, and try to use our software for project activity?
I will send you an email on that, Larissa, but I think that our grant awarding manager or coordinator is the one that is at least for our cost action, but there are many cost actions. So I will come back to you,
Maybe
Larissa.
okay, thank you.
Okay, you're welcome. If there are no other questions or remarks, then I will close this meeting. The meeting will be summarized and be published on the Net4H website, www.net4h.eu. And we will, thank you very much again for being so active in this workshop thing, and see you next time. Bye-bye.
Thank you to all of you.
Thank you. Bye-bye.
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 Thank you. Goodbye.